Welcome to our Rett syndrome presentation. My name is Rocio.
And my name is Valley. So, Rett syndrome, or RTT, is a rare progressive neurodevelopmental disorder that mainly occurs in females, but there's also research that has been progressive in males as well. It was first recognized in the late 1950s by Andreas Rett, who was a developmental pediatrician in Vienna, Austria, and also by Bengt Hagberg, who is a child neurologist in Sweden. So RTT is commonly caused by pathogenic variants in the methyl CpG binding protein 2 that is commonly found in the X chromosome, so in the female. It usually affects speech, movement, eating, and breathing, which also results in difficulty expressing or communicating despite understanding the words. RTT is also referred as cerebroatrophic hyperammonemia. And these are some pictures that were found in the International Rett Syndrome Foundation, real photos of real patients. So some key features for RTT, they are recognized by distinct set of clinical features that typically appear after an initial period of normal development. So most children with Rett syndrome appear to develop normally during the first 6 to 18 months of life. So it gradually regress, and so it becomes like the loss of purposeful hand functions and also like the loss of spoken language. So as purposeful hand use fades, repetitive hand movements known as the hand stereotypies, they commonly emerge. So these could be like the repetitive hand wringing and hand washing. Also like the gait abnormalities with the hypotonia and ataxia could also present. Another key feature is the breathing irregularities. So these are like the autonomic functions that the automatic processes that control the breathing, heart rate, and digestion. Moving on also with the key features is that there's like certain stages. So with stage one, it's like early onset. So typically starting between 6 to 18 months of age and can typically last for a few months or a year even. And then going on into the stage two, which is the rapid deterioration, typically starts between 1 to 4 years of age, and this is when the children lose the ability to perform skills they previously had. So, like maybe slowed head growth, atypical hand movements or stereotypies, hyperventilation, screaming, even problems with the gross movement and coordination. And then going on to the stage three is a plateau. It commonly begins like the ages of 2 to 10 years and can also again last for many years. And the last stage, which is a stage four, late motor deterioration, which could also begin after the age of 10 and can last for years or decades.
In terms of etiology, so the main reason or where this emerges is a mutation in the X-linked gene, which is the MECP2. And this is an active mutation on the X gene that then encodes for the um, MECP2. And when this happens is one of the MCEP2, the X-link, is expressed throughout the body, which common thing that it does is a disruption in the brain development. It is rare in males, as previously stated, but if presented in a male, it is more severe because males typically only carry one X chromosome. Therefore, they do not have that backup copy of the gene that will compensate for the defect of the X chromosome. So that in turn, that leads to a more severe expression throughout on the person, and then often has a lethal outcome in males. So prevalence worldwide, there is approximately five to 10 cases per 100,000 females, which is just worldwide. And then in terms of males, there's like very little research on them, unfortunately, but it at least one in every 15 to 100 males. In terms of the United States alone, is one in every 10,000 females by the age of 12 years old. Typically, that's when they are diagnosed by that age.
And so going on with the common co-occurring conditions, the most common one is the epileptic seizures. So it could also affect approximately 3 out of 4 individuals. The next one is the orthopedic disorders. This could mean like the spinal curvature and then also like hip displacement with a leg length discrepancy. And then bruxism or the teeth grinding, it's another notable feature for this, which may manifest not only in the mouth and tongue, but also as repetitive movements involving the hands, trunk, or lower limbs. Again, with the autonomic and respiratory irregularities, they could also be like hyperventilating, periods of apnea. There's also the cardiac abnormalities, which is the prolonged QT interval, which actually presents like roughly 1/3 of the patients. The gastrointestinal disorders, constipation, dysphagia, reflux, deceleration in growth, and even insufficient weight gain. That also comes with the premature onset of puberty and the sleep disturbances, with the somnambulism, nocturnal seizures, abrupt waking up, talking, laughter, and crying. So, persistent sleep problems can exacerbate behavioral challenges and could definitely impact overall quality of life. Now, going on with the medications, the very first one is the trofinetide, which actually is the first and only drug treatment in children 2 years old and above right now. It was just recently approved by the Food and Drug Administration as of March 2023. But the possible side effects it comes with diarrhea, convulsions, restlessness, fever, fatigue, and even nasopharyngitis. There's also like anti-epileptics, but again, an individual has to take note of the possible drowsiness, coordination changes, along with the muscle relaxants and analgesics, because it potentially can reduce activity tolerance, especially during occupational therapy sessions. With that comes with the possible side effects again with the nausea, headache, confusion, dizziness, and drowsiness. There's also the intestinal medications, but it comes with cramping, diarrhea, and constipation. So, before and during OT sessions, practitioners must monitor alertness and ensure safety with seizure management. It is also advisable to plan sessions around medication schedules.
So, what is the role of occupation therapy? So, in general, one of the main things that they have as a role is education, specifically with parent and caregiver, provide resources and tools, or in the community, or just at home, how to take care of their child or their loved ones, as there's a lot of progression in this disease. Communication in terms of being able to have the parents communicate with the child and vice versa through via like verbal cues or visual cues as well, and then and also be able to provide augmentative and alternative communication ACC devices to kids when they're no when that doesn't work or if they need additional support. One of the primary things that OT also you works on is improving hand function. This is due to the severe loss of purposeful hand use due to the regression of the disease, regression of the developmental via like something like the child would struggle with is feeding, so assisting, providing assisted devices, provide any environmental modifications needed for the child to succeed, and then also integrating sensory. And with that being said, the sensory integration is a big part of OT, as is used in daily activities and instrumental IADLs as well. And this is done to improve motor planning or any development of functional hand use as time progresses. Lastly, motor ataxia. OTs can provide weight-bearing activities to improve their balance, posture, and coordination, and as well as this also will improve the fine motor skills because it is typically in the hand, due to the hand loss, to the purposeful hand use. This will help with the improve the control of fingers and hands. To address any hand stereotypies interfering with the occupation of playing and feeding, OT will apply ASI, air sensor integration frame of reference, and compensation to guide this practice. Here are some of the other professionals that typically work with children with Rett syndrome, one of them being physical therapists. They work to improve their mobility, improve their motor function and balance, work on gait training and balance as well, prevent and manage any contract or contracted or joint stiffness, and prevent any deformities such as scoliosis. The other allied therapists that work with them as speech language pathologists. They work on improving communication skills, such as integrating language stimulation techniques, which enable or have provide like a way for the children to understand language or just increase their functional expression. Again, it could be via like ACC communication devices or any other communication or language stimulation that the parent and the child would benefit from and overall improve expressive language.
And so going on with the occupations and underlying skills that are affected, first one would be the hand stereotypies. These repetitive movements can make grasping and prehension difficult, which definitely affects functional hand use. So with that resulting is the self-care activities such as self-feeding and dressing, fine motor tasks, and even formal education can be significantly impacted. Now, with the loss of spoken language or apraxia, this greatly affects communication and social participation, even play, social play, and formal education, because the individual may struggle to express their needs or even participate fully in learning activities. With gait disturbances, though, it definitely affects the mobility, making it harder for the individual to move around independently and constantly seeking for um, the caregiver's help. This can actually influence social participation and play opportunities as well as functional hand use. Now, with the sleep disturbances, it can lead to fatigue, which reduces engagement in play, even formal education and social participation. With the respiratory irregularities, it can also impact endurance and tolerance for group activities, even for individual actually, as well as overall safety during participation in daily routines. So, in summary, for these symptoms, it does not only affect specific physical abilities, but also has broader implications for participation in self-care, play, social interaction, and formal education.
In terms of prognosis is typically that their early onset is before the ages of 18 months, the months of 18 months, which is severe. When the child gets diagnosed later on after 18 months, the severity is, well, it's considered mild, Rett syndrome mild. Life expectancy for most girls is they typically reach the age of 10. And as previously mentioned, in males, early adulthood is actually more common. If it is a Rett syndrome related death, they typically before the age of 25 and survivors that go to up to 55. And if somebody survives after the age of 25, there's a 78% survival chance. And then after 25 years old, it is considered the mortality is considered similar to the general public. In terms of the caregiver, help them, for example, with their ADLs on a daily basis. Communication barrier. Oftentimes, the parents report they don't know how to communicate their kids, and they feel defeated because they're not able to listen to their kids, and leads to severely or a huge impact on their both their quality of life and their children's quality of life. In terms of long cares for both caregiver and the individual diagnosed, there's the long-term cares in terms of physical is they both suffer a great deal because often that they don't know how to deal with that. Psychological, some parents express feeling depressed and anxious due to the condition of their kids. Social engagement, both the parents and the child reflect on that. The kids are not able to participate in play or be able to go out and engage like other children. And then in terms, their parents' social engagement also decreases due to the typically be caring for their kids and not be able to do what they used to be. Financial burden, of course, as mentioned before, kids are sometimes parents are often they have to stay home to take care of their kids, so then they feel that burden as the disease progresses. All right, so there's their case study. So our girl name is Daisy. She is a 5-year-old female diagnosed with Rett syndrome at the age of 21 months. She currently lives in a Vietnamese household with both parents, Kim and Hong, in a one-story house with her two older brothers who are 15 and 10 years old. They live in Los Angeles, California. Her family practices Buddhism, values the importance of family and harmony. Daisy attends kindergarten and has an individualized education program, IEP, Daisy is currently on anti-epileptic medications due to seizures and does not have any known allergies. She is curious and communicative, demonstrating interest and strength in playing with Legos, reading with her older brothers, and watching Peppa Pig on television. Daisy utilizes modified cups and utensils with grip aids for self-feeding. She currently receives OT services at an outpatient clinic. Due to her condition of mild Rett syndrome, she demonstrates deficits in functional hand use when self-feeding, struggles when communicating needs, difficulty holding Legos while playing, and presents with irregular breathing patterns during playtime. So for the occupations of client, the first one is play because that's what she loves to do, and then self-feeding because it's what she's also struggling with at this time. So for our first occupation, play, the client factors is in the first one being sensory function, specifically proprioceptor function, due to the loss of purposeful hand movement and ataxia as evident when she is playing. Performance skills is grip and reaching. The next client factor is muscle function, specifically muscle power, due to the loss of movement and coordination. The performance skills, grip, and endurance. Muscle function, again, this specifically with the muscle tone due to her impaired motor skills and repetitive movement, as that's why she is um, unable to pick up the Legos. The performance skills is stabilized in positioning. The next one is movement function, specific with the involuntary movement reactions as evident by the hand stereotypies that are she's currently experiencing, hand movement, and then with the coordinating motor control that she's having trouble with. The performance skills for this one is coordinate, manipulate, and reach.
And going on with the occupation number two, which is the self-feeding, under the neuromusculoskeletal and movement-related functions, Daisy presents with impaired purposeful hand use, involuntary hand-wringing movements, and even poor bilateral coordination. Therefore, she demonstrates fine motor challenges as evidenced by difficulty grasping utensils, stabilizing her bowl, and even coordinating movements to bring food to her mouth. With her muscle tone, it's characterized by hypertonicity and fluctuating tone, which contributes to poor trunk control and fatigue during mealtime activities. These factors impact her ability to maintain an upright posture, especially during longer seated tasks. In terms of performance skills, Daisy shows limitations in her ability to reach, stabilize, and coordinate movements effectively. And while she is motivated and engaged during mealtime and play, these motor control difficulties affect her independence in self-feeding and fine manipulation tasks, such as building with blocks and even Legos and holding small toys. Within her family's Vietnamese cultural context, shared mealtimes are an important and valued daily routine. So although Daisy experiences challenges in self-feeding and postural control, her family actively supports her participation by providing adaptive utensils with grip aids and encouraging her involvement during mealtimes. With this also is that it presents like sensory functions with both proprioceptive and tactile functions because of her decreased body awareness as evidenced by difficulty calibrating on utensils due to hand stereotypies and poor manipulation of food items. So with this kind of like representing with the performance skills is that Daisy demonstrates challenges in gripping and manipulating objects effectively, which impacts her success in both feeding and play activities. Moving on with the mental functions, her attention and praxis, she does struggle to initiate and sequence self-feeding tasks such as picking up utensils, scooping food, and even coordinating the movement to her mouth. She requires support to sequence her actions and attend to the task, especially in distracting or stimulating environments like family mealtimes with her two brothers around and her parents. And so these are our references, and thank you so much for listening to our Rett syndrome presentation.